Greetings, everyone. You are watching Infovideopedia, where learning meets joy with me, Shilpi Mahachan. Today, we will talk about some of the core concepts in pharmacology. Today, we will be talking about the basics in pharmacokinetics. So, let's get started. Let's understand what is pharmacokinetics and why it matters. The word pharmacokinetics comes from Greek. Pharmakon means drug, remedy, or poison. Perhaps a recognition that any substance can heal or harm depending on how it's used. This idea is central to pharmacokinetics that the right dose makes all the difference. Kinesis means movement. Therefore, pharmacokinetics refers to the movement of the drug within the body, from the moment it enters to how it's absorbed, distributed, metabolized, and eventually eliminated. In short, pharmacokinetics describes what the body does to the drug. A drug may have both desirable and undesirable effects, and a successful therapy really tries to find the right balance to maximize the benefits while minimizing the harm. There are some key fundamental questions that PK helps to answer. For example, how much? That is, what's the right amount of dose needed to produce a therapeutic effect? How often refers to the dosing frequency, since the drug levels decline over time. Route of administration. There can be many different routes of administration, including oral, nasal, intravenous, inhalation, subcutaneous, intramuscular, and even intrathecal. We will talk more about the routes of administration in just a moment. In what form the medication should be given? Some of the common forms include tablets, capsules, syrup, injection. How long refers to the length of the treatment. While some illnesses might just take a day or two, but some other might be chronic and a much longer treatment might be needed. Let's understand the routes of administration. How a drug enters the body is as important as the drug itself, and this is called the route of administration. Some of the common routes of administration include oral, that is by mouth. This is the most common and convenient route of administration. The drug is swallowed, absorbed in the gastrointestinal tract. For example, Tylenol or paracetamol is taken as a tablet or a syrup. It's absorbed in the gut and begins to work within, say, 30 to 60 minutes. Intravenous, as the name suggests, it's directly in the vein. This can offer immediate drug delivery into the bloodstream, and it's usually used when a fast action is required. For example, for severe pain relief, morphine may be given intravenously. Or chemotherapy drugs like doxorubicin are often given through an IV drip. Subcutaneous, as the name suggests, it's really under the skin. The drug is injected into the fatty tissue beneath the skin for slow and sustained absorption. Example, Ozempic is given once in a week for type 2 diabetes. It's given subcutaneously. Intramuscular is directly into the muscle. Inhalation through lungs. It delivers the drug directly into the respiratory tract. And many of the asthma medications are really given via inhalation through a nebulizer or an inhaler. Intranasal, again, as the name suggests, is via the nose. Drug is absorbed through the nasal mucosa, useful for both local and systemic effects. Many of the nasal sprays used to treat allergies are used in this form. Intrathecal is into the spinal canal. For example, If the site of action is spinal cord or brain, this route of administration may be used. Spinraza, that is an improved treatment for spinal muscular atrophy, is administered intrathecally. One question you might have is, what's the difference between subcutaneous and intramuscular? Because apparently it might seem both are quite similar. The difference is that the subcutaneous is injected in the fat layer just beneath the skin. Intramuscular is much deeper than subcutaneous. Even the needle that is used for subcutaneous injection is typically smaller, and the needle used for intramuscular is longer. The volumes of injection are usually smaller in subcutaneous, and larger volumes of drugs may be injected using intramuscular. Why we choose one over another? For example, subcutaneous may be preferred when a slow and steady absorption of a drug is needed, for example, insulin drugs. The drug is potent in small doses, and it's also the convenience of use. A patient can self-inject subcutaneous at home. Intramuscular dose is injected deeper into the muscle. For example, vaccines like flu shots and tetanus vaccine are given via intramuscular route of administration for a stronger immune activation. Let's take a quick look at some real-world examples. Paracetamol for pain relief and fever reduction. It's usually in the dosage form of a tablet or a syrup, and a typical dose is around 500 to 650 milligrams. Route of administration is usually oral, and the frequency of administration is around 4 to 6 hours. Tylenol is the name for paracetamol in US, and it's really for the same pain relief and fever reduction. Ozempic, given for type 2 diabetes, is in the dosage form of pre-filled injections. A typical dose is around 0.25 to 2 milligrams, and the route of administration is subcutaneous. The frequency is usually once a week. In this video, we covered the meaning of the word pharmacokinetics. Pharmakon means drug, remedy, or poison, and it reflects a timeless understanding that the same substance can be therapeutic or harmful depending on the dose, timing, and how it's administered. Pharmacokinetics refers to the movement of drug within the body and what body does to the drug. We also covered the routes of administration and looked at some real-life examples. In the next video, we will cover what is therapeutic window. We will cover concentration max and time max and some of the key parameters in pharmacokinetics. Thank you for watching. Stay tuned.